What I tried to do as UN Special Rapporteur on the right to health was to convey that human rights can be an asset and an ally for health workers, for health professionals. It's not something that's going to complicate their lives terribly. On the contrary, it's going to help them achieve their professional objectives. I tried to show that the right to health is in the Constitution of the World Health Organization, and it's in, effectively, the Universal Declaration of Human Rights. But the challenge is how to operationalize it, how to implement it. I'm a lawyer, a human rights lawyer. Human rights lawyers can't do that stuff. We need to have advice from, be guided by, be led by health workers if we are to implement the right to the highest attainable standard of health. It needs a partnership between the lawyers and the health workers and many others. The two themes that I focused on in particular were issues around poverty and discrimination, because they are two critically important barriers for many people to access to health care and also access to the underlying determinants of health. But what I also tried to do was cast around for specific issues that would resonate with the public, with lawyers, and with health workers. I took advice on what they might be, and I think I probably had a couple of false starts. But in the end, I did identify one particular issue which I think has proved apposite, and that was looking at maternal mortality in a human rights context. I remember I had to report to the UN Commission on Human Rights, the UN Human Rights Council, and also the Third Committee of the General Assembly on a regular basis. And the only occasion by oral presentations of my reports elicited applause was when I spoke for the first time about maternal mortality as a human rights issue. It did immediately resonate with people that yes, maternal mortality has important human rights dimensions, and it was time for maternal mortality to be understood as a human rights issue, to do with the right to health, the right to life, to do with equality, non-discrimination, international assistance and cooperation, and the whole lot. So framing it as a human rights issue, I think, struck a chord, and I'm thrilled and delighted that since then the issue has snowballed, and we've now had 3 resolutions and 3 reports out of the UN Human Rights Council on these issues, and we've now got technical guidance on maternal mortality, morbidity, and a human rights-based approach to those issues. And I think it's a critically important model. Well, one issue that I was really keen to look at, because it's often neglected, at least in the human rights community, and it was mental health. Again, looking at it through the prism of the right to health, and I felt this was really important. And when I went on missions, not always, but often, usually, I would ask to go and visit appropriate institutions and the appropriate health professionals, and sometimes that was quite shocking too. Some of the institutions that I visited were of a very poor quality and quite shocking. An issue that I see now emerging, and if I stick my neck out, I think it's the issue for the next sort of 3 or 4 years. It's child mortality and human rights. So we've now made some progress framing and understanding maternal mortality as a human rights issue and what that means, but I think it's time, and I think the time is ripe to look at, 6.9 million preventable under 5 deaths, framing that as a human rights issue, and framing that almost 50% of those deaths are newborn deaths. And I'm not saying that all of those deaths constitute a violation of human rights obligation. That would be too simplistic, but I suspect quite a few of them do. But more importantly, if we apply a human rights lens to that problem, I think it will help us identify what has to be done. And not just as good management, not just as good medical practice, but as a matter of legal obligation, in relation to which we should all be held accountable.